Bismillah ar-Rahman ar-Rahim. Today's lecture will be about septic arthritis, and this is the last subject in orthopedics, and it is a simple, short lecture. Causes either due to direct invasion through a penetrating wound, intra-articular injection, or arthroscopy, which is so common today, rather than hematogenous in these days. And as I told you, المجتمع اللي صحته زينة عملياته أكثر يكون عرضة للإياتروجينيك causes of infection، بينما المجتمع اللي يكون فقير وصحته العامة غير جيدة نشوف أنه الهيماتوجينous causes of infection is more. أو it could be due to direct spread from adjacent bone abscess أو blood spread from distal site. وهم التقسيم مالتنا نفس الشيء، يعني infants, children, adults. In infants, it's often difficult to tell whether the infection started in the metaphysis and spread to the joint or vice versa، وهذا الشيء أنا موضحه سابقا لكم، لأنه باعتبار أنه الميتافيزيال region والepiphysis أو الepiphyseal plate is within the articular capsule. The causal organism is usually Staphylococcus aureus. Still, it is the king. However, in children between 1 and 4 years old, Haemophilus influenzae is more important pathogen than other age groups. وهمنا نرجع نقول إنه Staphylococcus aureus is still the dominant. Predisposing condition نفس الشيء، كلها تشير إلى إما قلة البلد سبلاي أو low immunity، مثل rheumatoid arthritis, chronic debilitating disorders, intravenous drugs, immune suppressive, AIDS, etc. In pathology, there is acute synovitis with purulent joint effusion. Purulent joint effusion. مشكلة الجوينت يا جماعة إحنا إنه الكارتلج is usually nourished by the joint fluid. It do not has its own blood supply. هذا فرق عن البون. فلما يصير عندنا infection, it usually started at the synovium, then it spread to the adjacent cartilage, and it causes destruction to this cartilage by the enzymes which are released from the bacteria or the immunity. The cartilage may be completely destroyed or nothing will happen. If you catch the infection early or the immunity is very high, nothing will happen, healing will happen. Or there may be partial destruction of the articular cartilage or complete destruction of the articular cartilage, and this may lead to healing later on with what we call it the bony ankylosis. الانكيلوسيس هو عبارة عن fusion of the joint. الانكيلوسيس هو عبارة عن pathogenic fusion of the joint. وعندنا two types of ankylosis، bony ankylosis والfibrous ankylosis، واللي قابله هو الاريثروديسيس. الاريثروديسيس هو عبارة عن iatrogenic fusion of the joint. مرات نستعمل احنا عملية الاريثروديسيس، نفتح الجوينت نشيل الكارتلج ونخلي بون على بون ونثبته ونسوي fusion of the joint in certain diseases. هاي المصطلحات لازم تعرفوا واحد يجوز تمر عليكم. الكلينيكال فيتشرز نفس التقسيم، نيو بورن وعندنا children و adults. Newborn, usually there is septicemia rather than joint pain. The baby is irritable and refuses to feed. القاعدة العامة in infants, whenever you have good feeding, good oral feeding, عادة the disease is not so significant. Whenever the infant starts to be reluctant to feed, there is something serious. هذه خلوها ببالكم whenever you are treating an infant. Rapid pulse, sometimes fever, not always, sometimes hypothermia. هذا لأنه infant الاميونيتي مالتنا is not well developed. and there may be a reverse clinical feature. Infection is often suspected but it could be anywhere، ولهذا عندكم انتم بالاطفال تدرسون ما يسمى بالسكرينينج تيست اللي هو واحدة من عندها انه we are checking culture sensitivity of blood, we take CSF, we take culture sensitivity of stool, we take culture sensitivity of urine, etc. We are screening the infant because usually the clinical feature is not so clear. All the joints should be carefully felt and moved to elicit the local signs of warmth, tenderness, resistance to movement. Surely the umbilical cord should be examined for a source of infection، ومثل ما اتفقنا انه نخلي بالنا بالنewborn baby and infants, usually the mother as a source of infection. Children, acute pain in a single large joint, commonly the hip or the knee, are and reluctant to move the limb، مرات نسميه pseudo paralysis، ما يخلي أحد يطخه. This is sign of septic arthritis. Try to treat this child as fast as possible, because if you will treat him rapidly, nothing will happen. If you delay, you may have change in the growth or you may have destruction of the joint altogether. The child is ill with a rapid pulse, swinging fever on and off. Accordingly, the overlying skin looks red, and in superficial joints, يعني مو الهip, swelling may be obvious. There's local warmth and marked tenderness. In this picture, you can see that the left knee is red, swollen, hot. You can feel hotness. You can see that you have filling of this sulcus, this normal sulcus seen on the right knee in the medial surface. Here you can see that there is filling of this sulcus, indicating that you have effusion of the joint. هنا نفس الشيء، هذا شوية يعني body and the cure هذا patient. However, you can see that you have fullness of the joint, redness, and even you have redness in the adjacent area. Aspiration of the joint in this adult reveals a huge amount of pus. You can see that it is golden yellowish, which indicates that most likely the causative organism is Staph aureus. However, you have to send for culture and sensitivity, and surely this is diagnostic. Whenever you aspirate a joint and pus come out, this is diagnostic. Imaging, you may send your patient to ultrasonography, which is most reliable method for revealing joint effusion in early cases. However, it do not differentiate between pus and fluid. X-ray examination is usually normal مثل osteomyelitis, it is usually normal early on, but signs to be worse for soft tissue swelling, loss of tissue planes, widening of the radiographic joint space, signs of subluxation due to presence of fluid in the joint. However, all of these are not diagnostic or characteristic. Non-specific signs, you can say. E. coli infection, sometimes you have gas in the joint, narrowing irregularity of the joint space, fusion اللي هو سمينا ankylosis are late features. MRI and radionuclide imaging are helpful in diagnosing arthritis in obscure sites such as the sacroiliac joint, the sternoclavicular joints, the spine. هذه areas not usually easy to be diagnosed by the radiograph. هنا هذه a picture of MRI T2 weighted images. You can see clearly that you have effusion in the joint. All this is fluid, white in color. Yeah. Investigations, surely the white cell count and ESR are raised, and the blood culture may be positive, maybe. positive, not always. Aspiration of the joints and examination of the fluid, it may be frankly purulent, but beware. In early cases, the fluid may looks clear, so send for gram stain and culture sensitivity. Gram-positive cocci are probably Staphylococcus aureus. Gram-negative cocci are either Haemophilus influenzae or Corinella kynigi in children, or gonococcus in adults. The gonococcus infection is an important infection which usually affects large joints, and whenever you see arthritis, septic arthritis of the sternoclavicular joint, think of gonococcal infection. طبعا هنا احنا ليش بدنا نذكر جرام بوزيتيف جرام نيجاتيف؟ لانه بالمختبر عاده ممكن يرجعوا لكم الريزلت اوف جرام بوزيتيف اور جرام نيجاتيف at the same day. بس ال culture and sensitivity usually it takes longer period. الجنرال supportive بالنسبة للتريتمنت we have to do general supportive care اللي هي analgesics are given to pain and intravenous fluid for dehydration. Splintage in order to rest the joint, decrease the pain و prevent deformity. يعني احنا نحاول انه نخلي الني in extended 5 degree of flexion only in order to prevent flexion of the knee, because it will be more easier for the patient to tolerate pain in flexion. However, if he continue to flex the knee, he may get stiffness or destruction of the joint and fusion in flexed knee, and this is ultimately will affect his life. So try to splint the knee or splint the affected joint, wrist, elbow in functional position. وبالنسبة للhips, spines, usually you can use skin traction. Antibiotics ناخذ احنا عينة نسوي الانفستيجيشن مالتنا, we do aspiration of the joint, we send for culture and sensitivity, وبعدين نبدي empirical antibiotic management. The initial choice of antibiotic is based on judgment. The most likely pathogens, neonates, think of up to the age of 6 months, you have to think of a gram-negative organism, because I told you previously that the infection may be due to or maybe from the mother as a source of infection, birth canal usually hosted by gram-negative pathogens. However, still Staphylococcus aureus is the main criminal. So treat the child with anti-staph to start with anti-gram-negative pathogens. مثلا نختار flucloxacillin for the staph, third generation cephalosporin. Both are broad-spectrum antibiotic and acts well against both organisms, اللي هي gram-positive staph and the gram-negative organisms. Children from 6 months to puberty can be treated similarly unless they had been immunized. There is a risk of Haemophilus influenzae infection, so you have to choose an antibiotic which is suitable for this. Older teenagers and adults can be started on flucloxacillin and fusidic acid. If the initial examination shows gram-negative organism, a third-generation cephalosporin is added. Appropriate drugs can be substituted after full microbiological investigation. يعني احنا نبدي بهاي empirical antibiotics either to continue on or to change it according to the results of culture and sensitivity. The antibiotics should be given intravenously for 4 to 7 days. Sometimes some books said or till the fever subside, and then orally for another 3 to 5 weeks. يعني التوتال period of treatment حتكون عندنا شهر إلى شهر ونص. And also we'll send for seroactive protein ASR و blood cell differential all these parameters have to be negative before stoppage of antibiotics. Sometimes, if there is a huge collection of pus, you have to drain the joint and clear it from this infection, wash it well, and put the drain, start antibiotic, remove the drain later. Yeah. The complications of septic arthritis, subluxation and dislocation of the hip joint, sometimes damage of the cartilaginous physis or epiphysis in a growing child, and this may cause growth disturbance, retarded growth, partial or complete destruction of the epiphysis, deformity of the joint, epiphyseal osteonecrosis, acetabular dysplasia, pseudoarthrosis of the hip. All these are complications. Articular cartilage erosion, chondrolysis, ankylosis of the joint, which is usually bony and non-specific infection. Yeah. New subject. احنا عندنا TB or tuberculosis. Still, it is common in Iraq, and we have to concentrate on this subject. The skeletal manifestations of the disease are seen chiefly in the spine and the large joints, but the infection may appear in any bone or any synovial or bare cell sheath. Predisposing condition including chronic debilitating disorders, مثل diabetes, drug abuse, prolonged corticosteroids, AIDS, etc. The disease may begin as synovitis or osteomyelitis. From either, it can be extended to become a true arthritis. Not all the cartilage is destroyed, and healing is usually by fibrous ankylosis. انتبهوا يا شباب، هنا fibrous ankylosis not bony ankylosis. TB الديفرنس مات عن septic arthritis انه usually it ends by fibrous ankylosis، بينما septic arthritis usually it is ends by bony ankylosis. هاي من جهة الأخرى انه septic arthritis اللي هو non specific usually it may causes adjacent osteomyelitis and we have periosteal reaction، بينما هنا يكون عندنا para-articular osteoporosis. نشوف انه marked osteoporosis one of the clinical radiological features of TB. A tertiary lesion, bone or joints are affected in about 5% of patients with TB. طبعا تعرفون احنا ال TB يبدي primary in either in the gut or in the lung, then it passes to the lymph nodes, secondary, then it passes to the other parts of the body as a tertiary. There is a predilection for vertebral bodies and the large synovial joints. الTB عادة مزاج. الميكوبكتيريوم is usually have a high مزاج، يحب الاريا اللي هي cool، ولهذا عادة نشوف انه D12 L1 are affected by TB، بينما لما نشوف signs of infection in L4 5 usually it is related to the non-specific microorganism. يحب الني because it is subcutaneous and cool. And even the abscess of the TB, we usually call it cold abscess. Yes. هنا نشوف انه there is a marked periarticular osteoporosis in X-ray. You can see that the patient is ill, emaciated, loss of appetite, loss of weight، كلها general signs of TB. Prolonged history of cough. احنا مثلا كان اللي يجينا من قبل، اللي كان يجينا من أربيل مثلا عسكري أو مسجون، عادة نشيك for TB. Clinical features: there may be a history of previous infection or recent contact with TB. يعني طبعا هذا اللي ذكرته هو من ضمن geographical distribution of the disease. يعني اللي كان يجي من الجنوب بالهارزياسيس، اللي كان يجي من الشمال كان TB، وهذا previously. بصراحة هسه لما تغير الوضع مال البلد والنورشمنت والهذه، بدينا نشوف انه التي بي لا ما بدا يجينا من المناطق الشمالية، يعني من منطقة أربيل أو هاي، الحمد لله، لأنه وضعهم الاقتصادي والمالي صار أفضل عما كان قبل. ف you have to be aware of the endemic disease map of your country. Anyway, clinical features, there may be a history of previous infection or recent contact with tuberculosis. جتني مرة كيس مرة كان عندها mild backache. الباكيك كان بالupper lumbar vertebrae اللي هي unusual sites for pain. عادة البين بالlower lumbar vertebrae يكون due to disc prolapse or osteoarthritis. من يكون بالupper lumbar vertebrae think of infection أو إنه يكون تروما. فمن ضمن الهيستوري إنه عندنا loss of appetite, loss of weight. أكو أحد بالعائلة عندكم تي بي؟ قالت أني أساساً كان زوجي تي بي وظليت نيرسينج، أسوي له نيرسينج إلى أن he died. most likely it was a severe TB with a spreading of infection to hair from him. And when we took an X-ray, there was signs of osteoporosis. There was collapse of D11, D12, I think. We took MRI and we saw signs of TB at that time. ESR كان 100 plus, C-reactive protein highly positive, white blood cell lymphocytosis, all are signs of TB. Yeah. Unfortunately, and she diagnosed as a case of TB, and she received anti-TB treatment, and she cured, alhamdulillah. The patient, usually a child or young adult, complains of pain and in a superficial joint swelling. السويلنج مثل ما قلت لكم sometimes with not so marked hotness، لهذا يسموه cold abscess. In advanced cases there may be attacks of fever, night sweats, lassitude, loss of weight or appetite. Muscle wasting is characteristic يعني بالclinical examination. Synovial thickening is often striking. Sometimes we call it dewy feeling، يعني كأنما مثل العجينة. Regional lymph nodes may be enlarged and may be tender. بالإكس-راي marked peri-articular osteoporosis. هذا الفرق عن الكلينيكال. In TB of the spine, pain may be deceptively slight، يخدع. Often no more than an ache, and the spine is jarred. Consequently, the patient may not present it until there is a visible abscess, usually in the groin or lumbar region, or sometimes even in the inguinal region, and this is what we call it Pott's disease. Or sometimes till collapse and localized kyphosis may be noted. الإكس-راي مثل ما قلت لكم narrowing of the joint space, washed out appearance of the periarticular bone due to characteristic osteoporosis. Investigation ESR raised. Synovial fluid it's cloudy. Protein concentration is high. White cell count is elevated. Acid-fast bacilli are identified in synovial fluid only in 10 to 20% of cases. خلوا هذا بالكم. Cultures are positive in over half only of the cases. يعني negative culture do not exclude TB. Synovial biopsy is more reliable. A section will show the characteristic histological features of acid-fast bacilli which can be identified. Cultures are positive in about culture of the synovial tissue هنا is positive in about 80% of patients who have not received antimicrobial treatment. Some of antibiotics, especially the anti-gram-negative organisms, may diminish the TB clinical feature. Not always. However, it do not kill the TB altogether. Usually it needs combination therapy. Yeah. Treatment, rest, anti-TB, intensive course may extend up to 6 months and continue. The therapy may be up to 1 year with follow-up by ESI or blood cell, liver function, renal function test. Very important because you give antibiotic for long period of time, and these two important excretory uh, regions of the body are or may be affected. Surgical drainage, if you have collection of abscess, is very important, and you have to be patient with your patient. And another specific joint or bone infection is brucellosis. Brucellosis is still endemic in our country, and brucellosis of the bone or skeletal system is more or less similar to TB, usually affects the spine, عادة D12, L1, but can be found in different bones or joints, and it needs the usual investigation for brucella, and in puzzle cases you may need to use PCR to confirm the diagnosis. The treatment course is shorter than that of TB in general, and it should be less than 6 weeks, and also combined therapy is the rule. طبعا احنا ما ننسى انه عندنا الكلينيكال فيتشر اوف بروسيلا اللي هي انتم ماخذيها بالميديسن، hepatosplenomegaly, sometimes lymphadenopathy, sometimes it's flu-like infection, sometimes very high fever, sometimes low fever, long-standing cases. فهذه هي اللي تستعينون بها من الميديسن، وبس احنا بدنا نذكرها هنا بالجوينت. however it is not so common. It's only like the TB, only 5% of cases are affecting the joint, so you have to be aware of it. Swelling of the wrist, redness, warmth, sometimes follow local injection. You can see it also. The ankle joint may be affected. In diabetic patient, the infection may be started in the skin, cellulitis, and spread to the adjacent bone and joint. مرات يجيكم septic arthritis of the interphalangeal joint space. هنا you can see that this is a worker with dirt around the nails and around the fingers. Sometimes he may present it with infection in the hand. Infection, swelling, redness in the sternoclavicular joint. Be careful. You have to ask about gonococcal infection or history of gonococcal infection. Thank you.